and 95.3 FM.
Who's banged up? Who's in the training room? It's time for the Dr. Locke Sports Injury Report. In pain? Why operate when you can rejuvenate? DrLocks.com.
Well, and as you would expect, some big-time injuries in the National Football League in the first week, and I'm sure we'll see more as the season goes on, but they impacted some really big-time players. And to help us talk about it, we welcome in the good doctor right now, Dr. Dennis Locke. Good morning, doctor. How are you?
Good morning. How are you guys?
Good.
Doing really well. Let's start off in Dallas, where Dez Bryant has a broken foot. He had surgery, I guess, or he's going to have surgery on this, Dr. Locke. What does that entail, and how quickly can he come back? He's expected to come back, but kind of damage does this do?
Yes. Well, he has what's known as a Jones fracture. The long bones of the foot are kind of like your fingers, and then they insert onto the tarsal bones in your foot. And the fifth one is the fifth ray has a lot of weight bearing, but at the proximal end where it inserts close to the tarsal bones, when that is fractured at that point, they refer to that as a Jones fracture. And it's very problematic because when the tendons that evert your foot, they insert on that. So there's a lot of pull and tension against it. So a lot of times with athletes who have these fractures, they end up putting a screw in it to make it heal better so that it doesn't go into a non-union. And with wide receivers, it's very important that they heal properly. But there's a big difference in how much time some athletes can take, 4 to anywhere up to 12 weeks. And since he's their best receiver and had a big contract, being very conservative with him is very important.
Sure.
So you can probably expect that they're going to err on the more cautious side with an individual like this, because if it doesn't heal correctly and has a non-union or any complications, then it's just going to set him way back. And a receiver like this, it's more important to surgically correct it and make sure that it heals correctly and that the bone is in good place and doesn't have any long-term complications.
Sure.
Hey, Dr. Locke, the Carolina Panthers, one of their best players, Luke Kuechly, he's their middle linebacker, had a very obvious collision head-to-head, helmet-to-helmet, I guess, and was obviously knocked woozy. He has a concussion. And what I wondered about that is, you hear about these concussion protocols and how they have to pass certain tests before they're allowed back on the field. What does that entail? What is a concussion protocol?
It's typically a 3-step process, and I'm not a neurologist, but the basics behind it is first that you have to rest them and let them recover.
Right.
And they need a follow-up neurologic exam that they have in the preseason. So they have a sort of a baseline status of what this guy is like, how he thinks. So you have to get back to that baseline, and the team generally will say he looks pretty good or he sounds like his old self, and that means he's sort of acting like he was normally. Well, that's the first step. And then they put you back through an exercise protocol, something simple like riding a stationary bike or doing a little bit of exercise. And if you don't become symptomatic with that, then they become more progressive and have you do more exercise. And finally, in order to get back and be cleared to play with the team, first the doctors on the team and their medical staff have to clear you and say, we feel that this person is, back to baseline. And then an independent neurology doctor has to come in and then make their assessment and actually agree with the team that this patient has been cleared to play with the concussion protocol. So they're actually having to make it more difficult that the team has to get an outside source.
That's right.
Or put them back in the game.
Yeah, it's never an easy thing to deal with. Dr. Locke with the weekly injury report. Good stuff, Doctor. We appreciate your time.
Thank you so much.
That is the injury report brought to you by Dr. Locke's Sports and Regenerative Medicine. Want more info? Visit drlocks.com. In pain, why operate when you can rejuvenate? drlocks.com.